The last protocol we're going to go over is the maintenance of propofol or Diprivan infusion. So it's pretty much the same. The only thing that's changed is now all paramedics can transport propofol. You don't have to have a critical care paramedic or a nurse. So we'll go through the protocol real quick. That way everybody's just kind of familiar with it. I know a lot of us have never dealt with propofol a lot. I've gotten kind of comfortable with it just from my experience in the emergency room. But we'll go through it real quick. So propofol's drug class is an anesthetic or sedative. Its onset action is pretty quick. It's 30 to 45 seconds, and it can the effects of it can last 2 to 64 minutes. So using it, its only indication for us is going to be sedation for intubated or mechanically ventilated patients, or intubated and mechanically ventilated patients. So contraindications is going to be lack of ventilator support, increased intracranial pressure, impaired cerebral circulation, lipid metabolism disorders, severe cardiac dysfunction, documented hypersensitivity to the drug, so they're allergic to it, and use in labor and delivery may cause neonatal depression. So, precautions: use in hypovolemic patients may see a significant drop in blood pressure. Hypotension is seen in about 26% of adult and 17% of pediatric patients. You need to closely monitor these patients for cardiac dysfunction, including arrhythmias. Anxiety, agitation, and resistance to mechanical ventilation may occur with abrupt withdrawal. Adverse effects include bradycardia, hypotension, hypertension, decreased cardiac output, and torsades stimulant. If they do have torsades, it responds well to MAG, but we don't carry MAG. Nausea and vomiting, and involuntary muscle movements. So maintenance dose is going to be 5 to 50 mics per kilogram per minute. Available solution concentration is usually 100 milliliter vial at 10 milligrams per ml. So, guidelines for use: a paramedic is authorized to monitor a pre-established infusion of propofol. A critical care endorsement is required to initiate propofol. Propofol must be administered through an infusion pump. Paramedics may not initiate propofol therapy, but they may restart the infusion if it is interrupted due to infiltration, accidental disconnection of the IV line, malfunctioning pump, etc. All infusions must be restarted in accordance with the transferring orders. When receiving a report from the transferring RN or MD, always verify the physician's order for the infusion rate and check pump flow rate. Patients shall be placed and maintained on cardiac, pulse oximetry, and continuous waveform capnography monitors during transport. And again, remember, you have to keep all your intubated patients on your monitor until you transfer them at the next facility as well. Vital signs shall be assessed and documented at 15-minute intervals unless patient condition or interventions dictates more frequent intervals. For maintenance of sedation in intubated patients, propofol dosage will be initiated at the setting the transferring facility achieved. If the infusion is not already initiated, advise the facility to begin at 5 mics per kilogram per minute and titrate by 5 to 10 mics per kilogram per minute every 5 minutes until the desired effect reached or patient becomes hypotensive. If infusion pump failure occurs and cannot be corrected, the paramedic shall discontinue the infusion and utilize alternative sedation in accordance with local protocols. Document this in the PCR. All right, guys, I want to thank you for sitting through this class. I know it was a long one, and I was probably a little bit monotoned at times, but I think these protocols are some good changes. I think a lot of good things are happening in EMS here in Kentucky and at Ambulance Inc., and I'm really excited for them, and I hope you guys are too. If you guys have any questions about anything, please reach out to me. You can email me at cbrooks@ambulanceinc.com, or you can text me, call me anytime. I'm more than happy to help. So thanks, guys.